So my name is Anais and I'm a third year medical student at University College London and chair of the Rani Raju Studentship, which is a summer research programme that aims to assist first and second year UCL medical students in securing research placements over their summer. And one of our supporters is SHIONOGI. So at the moment, we have some small group teaching around patient communication, which is quite discussion based. And I've also been lucky to be involved in some interviews with patients with various difficulties in regards to communication to better understand their perspective, what they struggle with, and how best to communicate with them. Yeah, so I thought the manga project was great. I thought it gave a lot of practical tips in quite a novel format, which made it more memorable. I think in particular the fact that we were presented with a bunch of scenarios to kind of understand where patients were coming from in their perspective, and then through that were given practical tips, made the information a lot more digestible compared to just being given a bunch of bullet points and tips on a lecture slide, which is kind of what's happened before with this kind of teaching for us. So I really enjoyed it, and I know that because SHIONOGI was able to bring a few copies to our annual seminar and disseminate it to UCL medical students and talking to them, they also really enjoyed it and found it useful.
So I'm Crystal Rolfe. I'm the Director of Strategy at RNID. We're the national charity supporting people who are deaf, have hearing loss or tinnitus in the UK. Yes, so people who have hearing loss or who are deaf often struggle to book appointments in healthcare. They might not hear their name being called in the waiting room, or a British Sign Language interpreter is often not booked for them when they need it. And that means people often feel isolated, frightened. People describe being dehumanized, and that can mean that life-threatening conditions are missed or misunderstood, or the right treatment might not be offered. And that can also be the case in pharmacies, where people aren't understanding exactly what the problem is or how to use their medication in the right way, which can also lead to further problems with their healthcare. Certainly. So the manga project's really eye-catching and gives a really simple message. And we also know that different materials might work for different people. And so the manga materials might work for certain health professionals to really change their behaviours. And there might be other groups of professionals that a different kind of material might work really well as well. So we need to understand which materials work well to really change people's behaviours and make sure that everybody can access healthcare.